Okay, so thank you for joining us for this BASIL study Q&A video. My name's Andrew and I'm a research assistant and have been on the BASIL study since it started in March 2020. I'm joined by Professor David Ekers, who is the Joint Chief Investigator for the study. So thanks for doing this, Dave. Could you maybe start with just a bit about your role in the BASIL study, please?
Okay, yeah, so my role is as Chief Investigator of the BASIL study alongside my colleague, Professor Simon Gilbody. Our role is to have oversight of the study, support the study team in delivering all the elements of the study and making sure the studies run well and achieves the goals that we've set out in the protocol. So that means that we answer the study questions and we make sure that the study is conducted in a good scientific way to get clear and valid results.
Thank you. And why is the BASIL study focusing on the mental and physical health of the over 65s with the long-term conditions?
Well, the BASIL study evolved from another program of research that we were conducting called multimorbidity in older adults. And that's a study looking at the physical, mental health, well-being of people who are over 65 with 2 or more long-term health conditions. And we know that that group have considerably worse physical outcomes if they have associated low mood or depression with their condition. So we were working on that study and then the COVID pandemic hit. And what occurred to us very quickly in discussion with our service user involvement colleagues was that this group were going to be a group that were particularly affected by the social isolation that would come with the lockdown as a result of COVID-19. They were a group that were particularly at risk from the virus, and therefore they were a group that would need to shut down. And there was a particular concern of the impact of that on their psychological well-being. We had an intervention that was ready to go in the MODS program, and we could readily adapt that to the conditions that we were now finding ourselves in. And that's as such why we quickly adapted the MODS program into BASIL, which attends specifically to the consequences of shutdown for people.
Mm-hmm. And some people watching this video may know, some people might not, that BASIL has urgent public health status, and the pilot did, and now the main trial is going to have that as well. So would you be able to sort of let our viewers know what that actually means for the study to have that urgent public health status?
Yeah, sure. So urgent public health status is something that has come into being really since the start of the pandemic. Initially, when the pandemic hit and there was significant demand on the health service, pretty much all research in the NHS shut down or paused. That allowed research staff to be redeployed in order to help frontline clinical care, but it also protected study participants from unnecessary contact with others where there would be a risk of infection. But it became clear quite quickly that in order to see our way through the pandemic, there were certain areas where research was essential. And so the Department of Health and Social Care put together a structure for those studies that were deemed to have an important and immediate consequence on the progress and outcome of the pandemic. And those studies were given the title Urgent Public Health. Initially, those were studies that focused on the acute medical management of people. So there are a number of studies that were testing drugs that were given to people to try and mitigate the outcomes or the intensive care outcomes, for example, of the COVID virus. And then as time moved on, the impact on mental health was noted, and it was noted that there were no urgent public health studies in the mental health field. we thought that this study was particularly important, bearing in mind the impact that that the lockdown could have on people who are over 65 and then their mental well-being. And so we put our protocol into the Urgent Public Health Committee for consideration of its importance at this time. They thought it was a very important study and gave it the UPH badging. And what that does is it allows us to move forward with the study during the pandemic, so staff can be prioritized to the study. And it also gives us access to a lot of support from the clinical research networks across the country who are prioritizing the urgent public health studies to help us see our way through this time.
Thanks, Dave. Big question next. What will the BASIL study contribute to the research community and wider society?
Well, I think there's two areas to think about here. The first one is in times of a pandemic, and hopefully this will be the only one that we see for some considerable time of this nature, there are significant consequences, and we need to look at how and what brief interventions might be available that help us, I guess, lessen the worst of the psychological outcomes for people. And the intervention that we're testing in BASIL is one that is brief, that we can train a wide range of people to deliver, and it can be delivered remotely. So I suppose the idea is that, or the aim is that if this intervention is seen to be effective and acceptable to people, it's something that can be used in these difficult times. So during a pandemic, it could be an intervention that is able to be delivered at scale to people who are cut off from the world in lots of ways, but that can help them work out how to maintain their mood and their mental well-being. In terms of more generally and wider society, I think there is an ongoing issue in relation to social isolation and loneliness for this group. And one of the things that has become apparent during this time is the importance of that area. And BASIL's the first large-scale RCT to examine a potential intervention to try and to understand that and try and lessen the impact. So we're both looking at testing the intervention to see whether or not it works, but we're also looking at talking to a lot of people who receive the intervention and deliver the intervention through the BASIL study in order to help us understand how it works and perhaps how acceptable it is to those people on the receiving end.
Thank you. It's an interesting time at the time we're doing this video. The first vaccines are beginning to be administered, and so the next question is: how will our study remain relevant as more and more vaccines become available and the restrictions eventually do begin to ease?
Yeah, that's a good question, and I suppose it's a question that's linked to my last answer, and it's also a question that we ask ourselves quite a lot as a study team, and I think, I suppose as things ease, I imagine there'll still be quite a lot of nervousness about, and the Chief Medical Officer today is just talking about how it's really important that we ease restrictions very slowly, and I think we need to be really mindful of that for people who are at risk of the worst outcomes from this pandemic. So I think restrictions will be eased slowly, but fingers crossed, come next summer and the end of next summer, we will be in a very different place than we are now. However, I think what we learn from the BASIL study can be generalizable to helping us think about how we attend to the mental health of people that are shut down due to a range of physical health problems that perhaps cut them off from their world. And what we're testing in this intervention is an intervention that may be readily adaptable to be offered to those people to help them manage their mood and mental health at those times.
Mm-hmm. And often as researchers, we talk about how, taking part in these studies will, in the long term, change healthcare practice. But we, know that these things take a long time. But things like behavioural activation, can we expect to see that being used in healthcare in future?
I think so. I think behavioural activation is already used quite commonly in core mental health services in improving access to psychological therapy. We've been involved in researching this intervention for some period of time as a study team, and I think what we're exploring now is actually, we know it can work for depression, but is how durable and how we're able to apply it to different settings, like those people who have low mood and physical health problems. And we think as an intervention, it's particularly relevant in those areas. So I think over time it will become used more. I think one of the other useful things about behavioural activation is that it doesn't rely on very highly or specifically trained psychological therapists to deliver it. It appears that because it's quite a straightforward intervention, we can train a wider range of healthcare providers to deliver it. And so hopefully, if we can continue to see that trend in the studies that we're running at the moment, it will become an intervention that can perhaps cross the boundaries of that traditional mental health service. But we need to see the evidence as we move forward. We know it can work for depression. We know it can work in more common mental health services, but we need to see the evidence in a wider context to consider how far we can roll this intervention out, because there's clearly a need to see a person as a whole and their mental health and their physical health as very closely aligned. And that's what we try to do in this intervention. I know at the moment there's an ongoing National Institute for Health and Care Excellence review of depression at the moment, and they'll be looking at the evidence for behavioural activation closely at this time, or as part of that review. I'm not quite sure when that's going to give us some feedback, but I'm pretty confident behavioural activation will be seen more and more in the future as a key intervention that we can use in this field, in this area.
Thanks, Dave. And we don't know where people are going to be seeing this video, but where can we direct people to find out more information about the BASIL study?
Well, if they're the website that this video is going to be hopefully posted on is going to be a really good source of information. We do have a fairly active BASIL Twitter feed, so you can look that one up and have a look at that. And if you're particularly interested, feel free to drop the study team an email, because we're always pleased to hear people's thoughts and happy to get back to people.
Brilliant. Thanks, Dave. That's great.
Thank you very much.